Hello friends, my name is Dr. Saif and welcome to my YouTube channel. One rule which is very commonly discussed and described in literature is the 20-30-40 rule. So this 20-30-40 rule is very interesting. It is basically trio of spirometric spirometric measurements which can tell you the need for mechanical ventilation, which can tell you that this patient is going to progress into severe respiratory failure, and it will guide you to electively intubate the patient. So where this rule came from? A retrospective study published in 2001 by Lon et al. So the Lon was first to describe this rule. A study done in 114 patients, the critically ill patients with the diagnosis of Guillain-Barré syndrome who developed respiratory failure. About half of the patient they selected had requirement of mechanical ventilation and half of them did not. So this was a retrospective analysis, and in this analysis they performed multivariate regression analysis, and they found independent predictor of mechanical ventilation requirement. So the first one was the vital capacity and second was the bulbar involvement. In this study they concluded that this VC, MIP and MEP, these three spirometric measures were related to progression of respiratory failure. So they gave the cutoff. So the vital capacity less than 20 ml per kg, MIP, that is maximal inspiratory pressure, less than minus 30 centimeter of water, and the third criteria was the maximal expiratory pressure, that is MEP, less than 40 centimeter of water. So two pressures and one volume. Okay, so these three criteria were termed as the 20-30-40 rule. We need to know the validity. There is no concrete evidence to say that this rule is valid rule. Even in this study, they found only vital capacity and the bulbar involvement were independent predictor of requirement of mechanical ventilation. So other two parameters like MIP and MEP, they could not find any association because there were so many missing data as we see in any retrospective analysis. So we cannot certainly say that these other two parameters like MIP and MEP should be used, but people are using it. Okay, still using it, and they have used it since last 20 years. So somebody has to challenge. Only vital capacity, FVC, less than 20 ml per kg is the criteria to rely on. So vital capacity is the maximum volume of air which can be expelled out after maximal inspiration. So normally it is 60 to 70 ml per kg or 4 liter for a 70 kg human being. This volume is less than 1 liter in a 70 kg patient. Then that will definitely tell you that this patient has weak muscles and probably will require mechanical ventilation, and the mortality may be high, and you have to follow this patient. And there is one more thing, which is like you just measure VC at this point of time when you have measured it, but you serially monitor it like every 8 hourly, and you observe the patient, and if this is decreasing more than 30% from the baseline in 24 hours, that will also tell you that this patient is deteriorating in terms of muscle weakness and will require mechanical ventilation in future. So these patients should be admitted to ICU. But if somebody asks you, FEC is the only criteria to intubate or to select the patients for ICU admission, so I would say no. Because it is purely a clinical decision, and you need to assess the patient condition first, and you assess the patient frailty, you assess the patient's other medical parameters, okay, like previous medical illness and age, blood gases, and clinical status, and what was the trajectory before, how fast patient was progressing. So all these criteria, all these inputs you need to feed into your mind to decide whether this patient will require mechanical ventilation or not, or whether this patient will require ICU admission or not. So this is all experience based. So people have tried to make it more objective, but they fail to do so. I think AI might help, but still human judgment is important, and experience is important in selecting the patients who will benefit from mechanical ventilation. No single parameter or these kind of rules like rule 20-30-40 rule should be relied on, and it should be more of clinical decision. So that's all for today. Thank you for your attention. Kindly subscribe to my channel and like this channel, like this video, and share it with your friends for wider dissemination of important knowledge if you find this video very useful. So thank you for your support. Take care. Bye bye.